I'm Jennifer Bowers and I'm the Chief Executive of the Centre for Rural and Remote Mental Health in Queensland. Based in Cairns, the Centre's been operating since 2006 and arose after widespread consultation with academics, service, community, Indigenous, consumer and carer groups and other interested parties. Currently the Centre's participants include the Royal Flying Doctor Service Queensland, James Cook University, the University of Southern Queensland, the University of Queensland, Wichopper Health Service, Griffith University, Queensland Health, the Queensland University of Technology and AgForce Queensland. Our partners include service providers, not-for-profit organisations, business and industry, local, state and federal governments, specialists and researchers. The beliefs which drive the board and the management of the Centre are these. Australians who live and work in rural and remote regions are neither recognised, understood nor valued as they should be, especially given that this 6% of the broader Australian population produces 30% of our exports. People in rural and remote Australia live and work in conditions characterised by incessant and destabilising change, extreme weather events and the sharp end of climate change. Their communities are often marked by a lack of the sort of services that urban Australians take for granted. This lack of services often leads to social dysfunction, low resilience and self-esteem, compromised health and declining population levels, which lead to the withdrawal of even more services and more social dysfunction. The vicious cycle goes round and round. And to make matters worse, by virtue of their situation, people in rural and remote Australia are often not able to make a case for themselves to get the understanding and assistance that they need. The Centre also believes strongly that mental health and wellbeing underpin the very fabric of rural and remote Australia. That is, unless people have clear heads, their challenges appear insurmountable. And it's this which confirms the Centre's whole person, whole community approach to mental and therefore community health. The Centre's charter draws focus on three all-encompassing sectors in rural and remote Australia: Aboriginal and Torres Strait Islanders, agriculture and mining and resources. In our work, we demonstrate a commitment to practical outcomes, just like the communities and people for whom we work. We are proactive. We focus on early intervention, identifying problems on the horizon and preventing them where possible. Where we can't prevent problems, we support the delivery of integrated solutions and recovery mechanisms delivered in association with our partners, many of whom are long-term. But uninformed action is useless at best and dangerous at worst. So the Centre is committed to continuous learning and to gathering and sharing the best knowledge and evidence available about mental health and wellbeing. We are rigorous in our analysis, and it's only the knowledge that passes muster that the Centre uses to shape agendas and drive positive change. It's not possible here to outline all the Centre's initiatives, projects and achievements, but I'll mention just a few. Mental health in the mining and resources sector is, as yet, a largely unacknowledged issue. In July 2010, the Centre convened a roundtable in Brisbane to address the issue. It was agreed by all who attended that the understanding of mental health and of the need for specific policies and practices in the mining and resources sector was limited at best. The Centre has started working with senior mining executives and other stakeholders to build a business case for mental health strategies to be included in occupational health and safety frameworks across the sector. Two of the Centre's many successful programs, Creative Livelihoods and Pathways to Resilience, are being delivered in Cape York Indigenous communities, the Gulf Country, Mornington Island, Mount Isa and St George. These programs are activity-based and contribute in a concrete way to suicide and abuse prevention, recovery from mental illness and resilience building. People living in rural and remote areas and working in the agricultural sector are particularly exposed to mental health stressors. These stressors include climate change, extreme weather events, and economic and financial uncertainty. Me and My Community is the Centre's initiative to build capacity in these people so they can bring to their communities leadership, perspective and vision. In September 2010, the Centre convened another highly successful and influential international conference, Creating Futures 2010. This conference presented an exciting list of speakers and presenters from all over Australia, Canada, Hawaii and New Guinea, and these ideas shared and generated will emerge in future projects and initiatives. The Board and the Centre have earned for themselves a reputation for intelligent and sensitive advocacy, productive collaboration, world-class knowledge management, rigorous analysis and evaluation, coordination, and most importantly perhaps, practical applications. The Centre is committed to transparency, accountability and genuinely cooperative partnerships to bring about mental health and wellbeing for people who live in rural and remote Australia and their communities. The Centre for Rural and Remote Mental Health in Queensland. We're here for the long haul.